Welcome back. One of the best treatment and preventions of pain is fitness and physical therapy. Unfortunately, in the U.S., obesity and deconditioning seem to be the norm rather than the exception. KORT Physical Therapy has a wide breadth of practice and therapy options, but the treatment of pain, especially musculoskeletal pain, is one of their main areas of focus. I spent some time in the clinic learning some of the tools and techniques that get folks back on their feet and active. When someone thinks pain or an injury, they often think of rest and taking it easy for a while. But more and more research shows that return to activity, exercise, and fitness are keys to improvement and future prevention of pain and disability. Physical therapy can be a key tool to the recovery from painful conditions, focusing on the causes and the solutions.
Physical therapy is important not only for helping people to move again, which is one of our biggest focuses, is getting people back to their quality of life. But on top of that, we can help people get their pain levels down in order to be able to do what they want to do. So physical therapy not only is important for those things, but it can also help with tissue healing. So just like someone every day takes their pain medication in order to help with diabetes or heart issues, whatever it might be, same thing with physical therapy. So we can go in and we can change the actual tissue makeup of someone who has like even shoulder pain or back pain, whatever it might be, in order to get the tissues healthy so that they don't hurt anymore.
The issue is that decades of focus on pain medications has basically taken the proverbial eye off the ball of the best options for recovery.
I think people in general, and I remember before I was even a physical therapist, they think that, well, I need to go to the doctor, I need to get on some pain medication, and this will just go away. But that treatment program does not always fix the problem. Generally, if people have low back pain, they go back to the doctor again, and then again, and again. And it's this recurrent cycle that occurs without fixing the actual underlying problem. So with pain medication, that can oftentimes just be a Band-Aid that we lay over the problem so that people can kind of get through, but it doesn't fix the issue at hand.
And the treatment of pain is not always a quick fix.
Like pain goes, generally there's not always just an injury that occurs that causes the pain to happen. Some people will wake up in the morning and all of a sudden they're in pain. And so they ask me, how did this happen to me? What did I do to make this come on? And I say, I'm not sure, but I do know that when you don't move, when you're sedentary, when we age, things start to degenerate. And with that, we have to go through this regeneration process of doing specific training, specific exercises in order to get that tissue to heal properly again.
Probably one of the greatest sources of chronic pain in modern life is cancer. At KORT, Erin has been closely involved in the treatment of Bobbie Strong. Bobbie was diagnosed with stage 2 breast cancer, and by the time she had surgery, it had advanced to stage 4. With all of the treatments and toll of cancer, Bobbie had significant pain and physical limitations.
Fatigued. On top of that, she says that she cannot use her left arm, essentially. So it's so weak from having had so many lymph nodes removed that she can barely use her arm. On top of that, she's got pain running from her arm all the way up into her armpit and pain and pulling, and there's actually noticeable portions of her tissues that are kind of lumped up and very tight.
Because I didn't have grip strength, it pulled, it was really tight, it hurt all the way into my armpit, it was painful. And I couldn't even hold my son, so I was like, okay, I'll go. But yeah, I was scared at first.
Through persistence and hard work, Bobbie has made significant improvement.
Since I've been coming here, Erin's been making me work out every muscle possible in my arm, and then massaging the scar tissue, and I still have to do that even at home. Now I think my grip strength is 75 in my left arm. And then, as I couldn't stretch my arm out like this or even get anything off of the shelf without it hurting and pulling. And now I can do everything with my left side that I can do with my right.
She also reports that her pain has consistently improved.
The pain, every single time I came, it just eased up every time. And then, I would talk to Erin, or I would text her and be like, hey, this is going on, I may need to come in and see you. And she's like, okay, come in, you just let me know. We'll work that out. So that's been nice that I have her, so convenient.
And why is that so important? Because Bobbie is a young, active mother with children that won't stop because she is in pain or not feeling well. Bobbie had to get better to regain her independence and excel at her role as a mother.
I think if I hadn't come here, I would still be in the same position, still struggling to take care of him. You know, because I was having like friends come and stay with me, my grandmother, my parents were taking off work, my husband would take off work to come and just sit and help me throughout the day. Because I couldn't do much of anything without struggling, you know. And now that, since I've been here, it's all, like the pain is not there anymore, just the pull every now and then, but I've talked to Erin about it. We're actually, I think I'm going to come back in and just have her check it out, make me do some more exercises.
But it's not all about the exercises and work. Healthcare, physical therapy, and KORT are also about having someone to help you through a difficult time.
She's just needing someone to educate her and talk to her and just walk her through that process. I mean, Bobbie has my number, you know, we talk, or she asks me questions, and kind of even, I guess this was earlier this week as I was talking to her, I was going, did you get those results back? You know, any news, any updates? So it's just nice, I think, to have someone in your corner to talk them through something that we understand from a different standpoint, but I also understand on a compassionate human level and care about her and want the best for her.
In the end, Bobbie has a message for those that may not have considered physical therapy as an option for the management of painful conditions.
Honestly, like, I would highly recommend anybody with cancer pain or without, you know, if you're in pain at all whatsoever, like, I would recommend, hey, you need to go and do some exercises, or even have knowledge of like stuff that they can do at home if they don't want to come, you know, to KORT. But I would just say it's helped me. I don't know why anyone wouldn't want to. I don't want to sit and hurt, you know, so I would just tell people they need to come.
As they continue to work towards better health, function, and fitness, Erin and Bobbie have teamed up in a battle against cancer. Bobbie may have a long road of questions and recovery ahead, but she is committed to being the best patient and thus the best mother she can be. Physical therapy should be a consideration for many types of musculoskeletal pain. If you have a painful condition, ask your doctor if they feel you would benefit from a PT referral.